going to be learning about the signs of strokes, risk factors, and prevention. And we have Brenda Swihart with us. She is our Stroke Program Manager. So without any further delay, I will let Brenda take it away.
Thanks, Shanna. Good afternoon and welcome to today's presentation of stroke signs, risk factors, and prevention. May is Stroke Awareness Month, so this is a very timely time to be talking about it. I'm going to start with some statistics. Each year, approximately 795,000 people experience a new or recurrent stroke, with the majority of those, 610,000, being a first-time stroke. So a stroke occurs approximately every 40 seconds. And stroke ranks number 5 among all causes of death, with approximately 142,000 deaths per year. The major thing I really want to point out is that stroke is the number 1 cause of serious long-term disability. And that's why we talk about prevention, because there are ways to prevent and control some of our risk factors. I'll talk about a few things specific to different groups of people. First, I'm going to start out with women and stroke. Stroke kills more than twice as many women than breast cancer does each year. 1 in 5 women will have a stroke, and more women than men die from a stroke. The risk is higher for women due to a higher life expectancy, and women suffer greater disability after a stroke than men. So as I had mentioned, that disability is number 1 on the list for serious disability, and that's just why we talk about stroke, make people aware. Women between the ages of 45 and 54 have experienced a surge in stroke, mostly due to an increase of risk factors and lack of prevention knowledge. Another group is race and ethnicity. American Indians, Alaskan Natives, and African Americans are the highest risk groups for stroke. The risk of a first-time stroke is double that for an African American than the other ethnicities. African Americans also are twice as likely to die from a stroke than are Caucasians. They suffer more extensive physical impairment. And then lastly, Hispanics are more likely to suffer a stroke at a younger age. Some more statistics on stroke. Stroke incurs an estimated cost of $46 billion each year in the United States. And up to 80% of all strokes are preventable through risk factor management. We also have 6,400,000 stroke survivors in the US. So we do have a lot of people who survive strokes, and that ranges from very, very minor disability to some have extreme disabilities. This is a graph of the United States, and it shows you the most common cause of death other than heart disease or cancer by the states. Now, this is data from 2014, so it's a little old, but there is not anything newer than this to depict. However, as you can see, stroke is very prevalent as the most common cause of death other than the heart disease and cancer in numerous states, including Missouri. I'm going to talk a little bit about types of strokes. Not going to go real in depth on this, but there are two types. The first is an ischemic stroke, which is the most common type of stroke and accounts for 85% of strokes. This occurs when a blood clot forms and blocks the blood flow to part of the brain. The other type of stroke is a hemorrhagic stroke. This is where a weakened blood vessel ruptures and causes bleeding in or around the brain. An ischemic stroke, like we said, occurs when a clot or sometimes atherosclerosis, fatty deposits, breaks off and blocks a blood vessel downstream. And like I said, it accounts for about 87%. The hemorrhagic stroke we've already discussed. Lastly, I want to talk a little bit about TIAs, or transient ischemic attacks, and most people know these as mini strokes. But a TIA produces stroke-like symptoms, and it is caused by a clot, but unlike a true stroke, the blockage is temporary and generally causes no permanent damage to the brain. However, approximately 15% of all strokes occur after a TIA. So even if you have your symptoms resolve, they're only temporary. It is a medical emergency and needs to be checked out by medical personnel so that we can put you on the right treatment plan to try and help avoid a full-blown stroke. Next, I'm going to talk about some types of treatment for our acute strokes. There's a treatment called TPA, and this is where, oops, can you see? Oh, okay, you're right. I'm on the right script. I had my slides mixed up. This is a medication that's a clot buster that we can give to patients within 4.5 hours of their symptom onset. So it's very important, if you recognize any signs of a stroke, to get to the hospital immediately. And this is only in those patients who are having the ischemic stroke, which is caused by the blood clot. Time is of the essence. We have a very narrow window where we can administer that medication, and not all patients qualify. If you've had any bleeding recently, or if you take any type of blood thinning medication, you won't qualify for this, but we don't want you to wait around and think these symptoms will go away. We want you to call 911 and get help immediately. For the strokes that are hemorrhagic, there are a couple different means of treating these. The majority of hemorrhagic strokes are from an aneurysm that ruptured, and there's two types of procedures. One's a coiling of the aneurysm area in the vessel, where they just take a thin wire and they just wrap it around until they get that whole area of the aneurysm sealed off. Another one is where they use a clip, and that's a picture on the right, where they just clip off that aneurysm. So we'll move on to stroke recognition and risk factors. Risk factors highlighted or bolded are the most common risk factors for a stroke. And they are also some of the most common risk factors for heart disease. So stroke and heart disease go hand in hand as far as risk factor similarities are concerned. The major risk factor is hypertension or high blood pressure. And half of Americans have at least 3 of these risk factors. So it's very important to recognize and have these treated. More than 50% of Americans do not know that they are at risk. So as I said, 50% have these risk factors. Many of those, about the same percentage, do not even know that they're at risk. As we talked about earlier, 80% of those strokes can be prevented, and 77% of the first-time stroke patients do have hypertension. And as I talked to about the TIAs, about 15% are preceded by a TIA. Atrial fibrillation, where the heartbeat is irregular, puts you at a 5-time increased risk for having a stroke. Smoking places you at a 2 to 4-time increased risk of stroke. Diabetes puts you at a 1.5-time increased risk for stroke, and that risk also increases through all age brackets. And then untreated moderate to severe obstructive sleep apnea puts you at a 3 to 4-time increased risk for having a stroke. And all of these are treatable risk factors. So let's talk a little bit about recognizing a stroke. This is a tool we use here at our hospital to recognize a stroke, and we also teach the community about this. If you're having balance issues, loss of balance, a severe acute onset of a headache, which is not characteristic for you. Some people do have migraines, and they typically have migraines, but this is an absolute severe, worst headache of your life with an acute, sudden onset, and it peaks very quickly. And it may be accompanied with dizziness, and then when you get up to walk, you have some balance issues. Like might feel like you're leaning towards one side or the other. The E is for eye, and you can have blurred vision or you can have double vision. F is for face, so one side of the face may be drooping, and it's generally the lower part of the face, so the mouth is generally what you see drooping. A is for arms. This also includes our legs, so arm or leg weakness can occur. S is for speech difficulty. This can be extreme to where the patient cannot even get any words out, or it can be where they know a word but are just having difficulty finding that word, to slurred speech. So the speech can be a wide range of symptoms. And T is for time. As I said, we do not want you to wait. We want you to call EMS immediately. We do not want you to drive yourself, because if you're having a stroke, you could cause an accident, and that would make things worse for everyone. And secondly, EMS can alert us ahead of time that they're bringing in a stroke patient, and that gets our team rolling and allows EMS to do some things in the field as well. The one thing I want to point out about strokes is that most of the symptoms are unilateral, meaning one-sided. So you only have one side of your face droop, one side of your arm or leg being weak or impaired. And then with the balance, you would be leaning to one side, not both sides. Some additional symptoms of stroke are sudden numbness or weakness. And I've said on one side of the body, but some patients just have numbness and they don't recognize the weakness, or they may recognize it but describe it as a heavy feeling. Sudden confusion. Confusion also goes along with stroke, although most people don't recognize that as a stroke symptom, but it can be. Generally not by itself, but along with some other symptoms such as the trouble speaking and the weakness. The dizziness, the walking, I went over already, loss of balance and coordination. And then like I talked about, the sudden severe headache. And this is like a sudden acute rapid onset. This is a little quiz that you can take to identify your risk for stroke. And this, you can just go online and find it on the American Heart Association website. And it gives you things about your blood pressure, whether you have the irregular heart rhythm that I talked about, atrial fibrillation, diabetes, if you have any problems with obesity, and it will score you as a high risk or low risk if you say no or you don't know. And that gives you some idea of your risk score for stroke. Now that we know the risk, we're going to talk about prevention. So hypertension, as I said, is the biggest #1 risk factor that can be treated. So hypertension is broken out into stages. If your blood pressure is less than 120/80, you have a normal blood pressure. It's going to be considered elevated if it's between 120 to 129 over less than 90. And then hypertension stage 1 is when your blood pressure is between 130 to 139 or a diastolic of 80 to 89. At this stage, your doctor most likely will begin to prescribe lifestyle changes and may consider a blood pressure medication based on your risk score of all heart disease along with stroke. At hypertension stage 2, it's 140/90 or higher. And at this stage, you're probably already going to be on medication and maybe even have to have a combination of medications to control your blood pressure. And stage 3 is a hypertensive crisis. This is higher than 180/120. If you're in a hypertensive crisis, that requires immediate medical attention. If it stays above 180/120. What I recommend is that you wait 5 minutes, check your blood pressure. If it's still that high, contact your doctor immediately. If it's high and you experience any symptoms such as chest pain, shortness of air, back pain, numbness, weakness, any of the symptoms of stroke that I've talked about, just call 911. We'd rather get you in here and get you evaluated to see if you are having a stroke or if it's just your blood pressure actually causing these symptoms, because high blood pressure can actually cause symptoms such as the numbness and the weakness and the difficulty in your vision, changes in your vision. So what does it mean to have hypertension? So just a brief discussion about what it is. The top number, or what we call systolic, is how much pressure your blood is exerting against the walls of your artery when the heart beats. So when you have high blood pressure, that is exerting much more pressure against those artery walls during each heartbeat. The diastolic, or lower number, is how much pressure your blood is exerting against those walls when the heart is resting between beats. So again, if it's high, you're still having a lot of pressure on those artery walls, even at rest. Typically, your top number, systolic blood pressure, rises slowly but steadily with age due to an increased stiffness of the arteries, buildup of plaque over time, and an increased incidence of cardiac and vascular diseases. When your blood pressure is too high for too long, and the LDL, or bad cholesterol, begins to accumulate along tears in the artery walls, and these tears are created by the sustained high blood pressure, and this increases your risk of developing a really potentially life-threatening condition. It also affects your body. High blood pressure affects your body in many ways. As I talked about, stroke, heart attack, heart failure, kidney failure, and also sexual dysfunction. These are a few tips to help with your risk factor modification. So control your blood pressure. I just can't say that enough. It's the #1 risk factor. So take steps to control it by eating healthy, getting good quality sleep, be physically active. It does not matter what you do, but any little activity throughout the day can make a big difference. If you're not at your ideal weight, try to lose weight. If you smoke, I have nothing to say except stop. Smoking is so bad for you. It's terrible. If you have diabetes, control your blood sugar, and manage your cholesterol. If you have high cholesterol, either through diet, or if you're beyond the point that diet doesn't work, then you may have to be on medication. So know your blood pressure. That's the beginning steps. Know what it is. Go to the doctor. If you don't already, you should go to the doctor at least annually and have your blood pressure checked. More frequently if you do have high blood pressure. Find out if you have atrial fibrillation, the irregular heartbeat I talked about. And if you have it, you need to work with your doctor to manage it. There are ways to manage it with medication, or there are other measures which can be utilized for atrial fibrillation. And again, if you smoke, stop. This is another item you can get online through the AHA. It's a blood pressure log. It's good if you do have high blood pressure to check your blood pressure. At least daily, twice a day is preferable, and log it. Keep this log, take this log with you to the doctor every time you go. And I think I said it, but if I didn't, this log is available on the American Heart Association website. So I said, let's check our blood pressure. So if you don't already, and you do have high blood pressure, you should have a home monitoring blood pressure kit. Your healthcare provider can help you with finding a blood pressure kit, but these are widely available. You can pretty much buy them at any CVS, Walgreens, Amazon. If you go online to buy it, you can buy blood pressure kits at many of these places. So to get an accurate blood pressure, there's a few things that you should do. First thing in the morning, don't smoke or drink any caffeine or do any exercise within 30 minutes of checking your blood pressure. Sit in a comfortable chair, resting with your arm relaxed, and take 2 readings 1 minute apart. This says your left arm. It really doesn't matter, right, left. Left's easier for right-handed people. So that's kind of why it says that. Use a cuff that's a proper size and fit. That's important to get an accurate reading. If you're a larger size person, you might need a larger cuff. And make sure that the cuff is just above the bend of your elbow before you check your blood pressure. So if you have a 10 millimeter, if you can reduce your blood pressure by 10 millimeters of mercury, and that's how we read our blood pressure, it can significantly reduce several conditions such as coronary heart disease by 17%, stroke by 27%, and heart failure by 28%. Some more prevention guidelines. If you drink alcohol, do so in moderation. Know your cholesterol numbers. If it's high, work with your doctor to control it. Like I said, sometimes diet alone will be enough, but if it's not sufficient, then you may have to be on medication. If you're diabetic, follow your doctor's recommendations for controlling your diabetes. Make sure you're checking your blood glucose and taking your medications as prescribed. Some things that will raise your blood pressure, and I kind of talked about this as far as before you check your blood pressure, avoid alcohol. Alcohol can raise your blood pressure. Certain drugs can raise your blood pressure, and caffeine can raise your blood pressure. So antidepressants, some medications that are prescribed can still raise your blood pressure. So if you are taking something and you know you have high blood pressure and it might be, the medication might be in conflict with that, be sure and talk to your healthcare provider. So include daily exercise in your routine. As I talked about, some activity is better than nothing. So if you just get out take a walk around the park or a walk around work. I have a very sedentary job and I have to set my watch to remind me hourly to get up and walk. And that's just one little thing that I do. You can do what you can do, and everybody can do a little bit of something for exercise. Make sure you watch your sodium and fats on your diet. If you have circulatory problems, work with your doctor on that to improve it. And again, if you have any of these stroke symptoms, call 911 immediately. If you're having issues with following your guidelines for your blood pressure, such as watching or having a low sodium intake, exercising, or you have a high level of stress, be sure and discuss this with your physician. Because medications only work if you take them regularly, routinely, as scheduled. Do not stop taking your medications without consulting your physician first. And you should always take your medicine at the same time every day. And I suggest using a calendar or a pill box to help as a reminder. Remember, even small changes will make a difference. I didn't talk about it. I talked about smoking, but vaping is also extremely bad for your lungs. And so and we do see patients, we've seen younger patients these days having strokes. So vaping is an issue. Maintaining your healthy weight, eating healthy, dieting, limiting your intake, and taking your medicines properly. And lastly, stroke. May is May measurement month. So May is the month to check your blood pressure. It is the #1 contributing risk for global death. It usually has no symptoms, so you may not know that you have it. Often treatable. The simplest way to know if you have high blood pressure is to get tested. And only about half of those people with high blood pressure are aware of it. So I know that our hospital and our outreach program is hosting several events during the month of May for blood pressure checks. So get on our website and check it out. And again, if you're having any symptoms of a stroke, do not drive yourself, call 911. Thank you. Any questions?
Thank you very much, Brenda. So guys, if you have any questions, you can go ahead and ask them in the Q&A in the chat. I do want to let everyone know that this will also be posted to YouTube to watch in the future, as well as you will have an option to ask any questions on YouTube as well. So Brenda, I am so glad you could do this for us, being Stroke Month, Stroke Awareness Month. I am very happy that you could come and share your knowledge and wisdom with us. So I think that I'm going to go ahead and sign us off. Brenda, thank you so much for all your time.
Thank you, Shanna.
Bye.